My name is OFIR. This presentation is a research in progress dealing with forecasting hospital lengths of stay using EHRs with machine learning models. So at first, interoperability and HIE between different medical points of care have been introduced in the last 2 decades. The use of EHR in emergency department is especially interesting under time constraints. The economical benefits are there to prove. So I'll just skip one slide. The target of this specific paper was to assess the role of EHR data and the impact of general information system in predicting longer hospital lengths of stay using machine learning model. This was made by exploring various machine learning model, including random forest from several types and neural networks. Now, we use the track log analysis method, and the length of stay we studied from the beginning of the literature reading was length of stay of above 5 days. We integrated variables such as previous encounters, patient previous diagnosis, list of permanent medication, previous lab tests, allergies, community clinics, demography, and etc. Now, we used these types of classification method. We used Gini importance, we used information gain with entropy, and we used neural network, which was the last method we used for this research in progress. But nowadays we are developing more methods and more for chronic frequent chronic disease cases or patients in the emergency department. So I will skip the explanation on the method since the track chair asked me to try to squeeze it in 5 minutes. So I'm skipping all this and I'm getting into the results. So descriptive, statistical and predictive results. So overall, the average age for the patient referral was around 48. Most of the patients were female, about 58%, and most of the time the HRE was used. Length of stay, the average number of days in the hospital was 3.7. If you will look on table 2, the predictive analysis, the neural network had the best accuracy, F1 precision, and PR AUC. Pay attention, it's not the AUC. It's precision recall, which is more severe, but it is more reliable in the medical arena mostly and recently also. And the second best was random forest with Gini, with actually the highest recall score, which is interesting since the recall is a very good sign for the next step in our research for the chronic disease patient. So for knowing the true negative out of the whole population of sick. So in this manner of this research, we are researching the longer period of time in the emergency department and then afterwards in the units. But pay attention that inside the units, the patients can get infections, other deteriorations of medical problem and other gain problem that which they didn't came from in the beginning. Discussion. So the current results should suggest that using EHR actually contributes significantly to the accuracy and LOC and the length of stay prediction. I didn't share all the results here. I'm trying to squeeze it as the lecturer told me. And the future step will be well, we cannot claim for any causality using machine learning, but at least we should consider other examinations, such as smoothing the data or using propensity score matching or other technique in order to get more value for our results and develop other predictive models for future medical outcomes also. That's it from my side.
Thank you so much, sir.